Hi, good evening, everybody. It's another Wednesday, another live chat, and again, we have Dr. Azlina back with us. Thank you very much, Azlina, for coming back because I accidentally deleted the last chat. Okay, we are going to talk about breast cancer, and as you can see here, both of us have something pink on. Anyway, congratulations, Azlina, on your being a council member of what, the Council of Surgeon?
College of Surgeons of Malaysia.
College of Surgeon, yes, the College of Surgeon. So, how
Thank
many
you.
people are there in this Council of College of Surgeons?
Well, the president of the College of Surgeons, the current one, is Professor April. She's a lady. She's a colorectal surgeon by profession. And then there's council members, there's me, and there's another, let me see, one, two, so there's three of us in the council. Three women in the council. Yeah.
So we are quite well represented in the council. Would you not say that?
Well, we try.
Because
So,
about 10, 15, 20 years ago, would you have said that there will be a woman in the council?
well, at one time, only the president was a woman, and the rest were men. So over the years, we've tried to improve on the ratio because there are quite a number of female surgeons. So we need to be represented to hear and to encourage more female surgeons in Malaysia, because
Not
as
only,
you
not
know,
only female surgeons, right? Female, yeah.
well, the majority of female surgeons are in, I would say, the breast surgeons. Uh, Quite a number are ophthalmologists, the eye surgeons, the ENT. Of course, the other surgical fraternities, our obstetrics and gynecologists.
I've never met an ENT surgeon who is a woman, neither have I. Yeah, I've met women orthopedic surgeon, but not a woman ENT surgeon.
Well, where I work in one of the hospitals that I work, the majority is actually, I wouldn't say majority, but there are two female ENT surgeons.
I see. Okay, come back to this breast surgery.
Yes.
As a breast surgeon, I mean, being a woman, is there an advantage to it?
Well, as a woman, we would understand the intricacies of having breast issues. They may not be any abnormalities, but the breast is affected by our female hormones, which are produced in our from our ovaries and the adrenals. So there are subtle things like like the menstrual tenderness that you get in the breast, and that for some women it's a monthly occurrence. So if they don't are made aware that it's actually part of being part of the normal situation in being a woman, that the monthlies they call it. These are the intricacies. I wouldn't. The thing is, why I ended up being a breast surgeon was that as a junior MO, see the breast cancer being the highest cancer in women,
Yes.
and is also the highest incidence in the world out of all the cancers.
Yes.
Um,
Common cancer, right?
yes, I would observe that women who had breast problems would get very anxious waiting to see, especially those that come for their first appointment, the first consultation. I would notice that they get so anxious. And in the government hospital, you can't pick your doctor.
Oh,
You know,
yes.
you're sitting there in the corner and hoping you get a lady doctor. So it's just human nature. I'm not going to sit here and say that female breast surgeons are better than men. I'm just saying that as a woman, they feel more comfortable with women.
And
Similarly, when it comes to urology,
prostate. Yes,
ah,
that's right.
yeah, when I was in the urology department, and it's a compulsory posting in Masters of General Surgery. Okay, so I had to do 3 months of urology, and I would sit there in the clinic, and the patients would come through and say, "I want to see the doctor." When I tell them, I am the doctor, no, I don't want to see you. I want to see a male doctor. Well,
Yes,
if you want to see a male doctor, you got to wait. I don't mind. I will wait until 6 p.m.
yes.
So it's just human nature.
Yes, I think it's human nature, and more so in the Asian population, Asian ladies. We are, how to say, I can't say myself as modest, but we are more modest. But
Yes,
even I think, would feel more comfortable seeing a lady gynae and a lady breast surgeon. Um, and also, I feel maybe it is possibly, okay, I do not want to offend the guys. It is possibly that we women are more empathetic. Now, breast surgery is, especially for breast cancer, can be a very disfiguring surgery.
yes,
Um, I want to ask you, is it now more common, because I'm seeing women more commonly doing lumpectomy for breast cancer compared to a very radical surgery which we call mastectomy. Can you just
yes,
tell the audience what's the difference between a lumpectomy and a mastectomy? Oh, you got some illustration. Great.
yes. Okay, let me see. Let me adjust this nicely. Of course,
Okay.
it'll be in reverse, mirror image. Oh, okay, that's correct. Okay, breast tumor surgery. Now, these are just very simplified forms of ex- let me see. Okay, just explaining the types of breast
Surgery.
cancer surgery. So, a lumpectomy, or how we term it as wide local excision, is removing the lump and some lymph nodes to detect whether there's any spread, but preserving the rest of the surgery. So, this and this are called breast conserving surgeries. Now, with mastectomy, we remove the whole breast. But these days, what has improved over the last 10 years to 15 years is that if patients come with larger breast cancers, we can actually downsize and reduce the size of the cancers by giving the patients chemotherapy first, which is medicines through injections, reduce the size so that we can do breast conserving surgery or lumpectomies
I
rather
see.
than removing the whole breast, provided that the cancer is just in one spot. That means just a single focus cancer. Because if the cancer is in two or more spots, we cannot preserve the breast. But
And how long do we wait? How long do we give the chemotherapy before we do the surgery?
well, it depends on the oncologist. Most commonly, we give them 4 to 6 cycles before
Okay.
we complete the chemotherapy, and then we perform the surgery. Now, there is also another option where the patients, if the cancer is multifocal, we can remove the whole breast and perform immediate reconstruction where we can use the patient's own body tissues. We can take out the spare tire,
Oh my
the
God.
uh,
So, I mean,
and
it's bad news, but
remove the breast.
at the same
Yeah.
time, you do. Is it like a liposuction?
No, no, it's not. We There are two types of breast surgeons. One, for me, I work together with the plastic surgeons, and there is another breast surgeon called breast oncoplastic surgeon, where they can do certain reconstructions on their own. So what happens is we remove the anterior abdominal wall with the muscle and the
Okay.
skin, and we tunnel it, go upwards, and we tunnel it, and then we take it out from the bed of where the previous breast was, where the cancer was, and then we create a breast out of patient's own tissue. Or we can take muscles from the back, from the latissimus dorsi muscle, and we can put implants underneath the muscle so that outwardly and under a bra or bikini, the patient appears as if she still has her breasts. So a
How
lot
do
can
you
be done.
preserve? Is it possible to preserve nipple in a breast
Yes,
surgery?
yes, provided that the cancer itself is not directly underneath the nipple, because the structures of the breast, yeah, okay, yeah,
Okay.
because of the breast tissue and the nipple. Okay, so
Yes.
if the cancer is not close to the nipple, we can do nipple sparing mastectomy. That means we preserve the nipple and areola. But if it's directly underneath, we'd have to sacrifice the nipple and areola. But the plastic surgeon can make a
Oh,
nipple, and later we can suggest to them that they can go for tattooing services to
okay.
make, right, the both the nipple and areola similar in color.
Okay. It may look, I mean, may sound very funny that this now you already been diagnosed with cancer, right? And
Mm-hmm.
why are we so worried about the nipple and the breast? Okay, we want to save the life, but to me, okay, as much as we can, we want to preserve what would look normal. Okay,
Yes,
is how
exactly.
important is the nipple to a woman?
Okay, now it depends. You see, all this involves a lot of counseling for the patients. First of all, we have to break the news that the patient has cancer. Okay, let it sink in for a while, and then they will say, okay, what next? So, if the patient is suitable for these sort of surgeries, if it's indicated, I will discuss it with them, and then let them have a few days to think about it. Um, Now, the thing with reconstruction surgery, um, it depends on each individual. Some are not too concerned. They'll say, just take out the cancer, doctor. I'm not too bothered about reconstruction, especially the much older women. However, I have met 60-year-olds who are still interested in recreating their breast, the reconstruction. So it's a very individualized thing to discuss. So if they are interested, then I discuss the nitty gritty of the
Yes.
reconstruction and then refer them to the plastic surgeon. The thing is, sometimes when people say, "Oh, Azlina is cancer," when I speak to some of our medical colleagues, it's cancer. Let's just take it out. The thing is, for the patient, every day of her life henceforth, she is going to look at herself in the mirror. So, as much as possible, some of them, they want to appear normal. They want outwardly to be recognized as normal and not singled out as having breast cancer. So, if it's possible, I think we should try and accommodate all these requests when
Okay.
it's possible.
We have a question here. Sorry.
Hmm.
Nobody Hussein asks, can the patient choose mastectomy that rather than lumpectomy? And I would then like to elaborate and ask you more. If the patient chooses mastectomy rather than lumpectomy, is there an advantage if the cancer is early?
Okay, in terms of survival, the mastectomy and lumpectomy, together with the additional treatment, which is chemotherapy if necessary, the hormonal therapy if necessary, the radiation if necessary, the survival is the same. However, in the last few years, there was a paper that mentioned that those who had lumpectomy, because they had extra radiotherapy, it's a slightly better survival. Now, when you asked, when the question came
Nobody?
earlier, is there, can the patient choose for mastectomy? Yes, definitely. I will discuss the options when it is possible, and if they still insist on, I can, when I discuss if it's possible to do breast conserving or mastectomy. That's why I give the patients a few days to decide, because like I always tell them, once you've taken out the breast, you can't patch it back unless they want to do delayed reconstruction, which is still possible in a few years' time. I've had patients where they've decided on mastectomy and then they change their minds in about 2 to 3 years. And I tell them it's always possible. I'll get the plastic surgeon colleague
Yeah.
to discuss with them. And where what happens is, because with the mastectomy, everything's removed, so there's just skin, okay, a flat breast. So what happens is they would have to have a temporary implant, which is called a tissue expander, planted underneath the muscle to stretch the skin for about a year or two, and then a permanent implant is put in. That's
Okay.
possible still.
I want to actually so let's just make it more concise for Nobini. That yes, you can choose
Mm-hmm,
mastectomy, but
mm-hmm.
as Asina has said, if you present early and the studies have shown that there is no added benefit to do mastectomy compared to lumpectomy, right? The survival
Mm.
rate is the same.
Same.
So
Yeah.
your choice of doing mastectomy then is not based on evidence. Okay.
Mm.
Secondly, I I find it really weird that okay, a woman, okay, can be pregnant 9 months with a baby so big and the stomach can stretch so the skin can stretch so much, but yet when we do a mastectomy, the skin is so difficult to stretch. Why is
Well,
that?
skin at different parts of our body are of different thickness. That's the thing. So with the breast, you can stretch it, but it takes a much longer time. You see, and I noticed now I can see the question. A few cases from Norbani,
Yeah.
new cases from our group had problems after lumpectomy. I always tell patients, if you have issues, go back to the same doctor to discuss instead of keeping quiet. And you may never know, there might be different options to sort out whatever problems they've had after lumpectomy. Now, what I can predict when patients say they've had problems after lumpectomy, sometimes the scar itself is distorted. Sometimes you get the nipple, after scarring, after radiotherapy, like, they might be pointing a different way, and then even with
Noted.
yes, yes, even with bras, it might still look very obvious. So I always tell them, please go back to your doctor to discuss. And if you feel still unhappy, get a second opinion, because there's so many things that can be done with breast scars and lumpectomy scars. At the end of the day, it is all a matter of communication and whether that particular expertise is available in your town in Malaysia. Like I mentioned, like I always mention, in Malaysia, according to the National Specialist Register, breast surgeons total is 55 in the whole country, and majority are in Klang Valley, KL and Selangor. So states like Kedah, Perlis, and Pahang do not have any breast surgeons uh,
Yeah.
being posted there.
So
And
they,
that
it
and
is done by general surgeons.
general surgeons, there are the majority of the work for breast problems are done by general surgeons, because definitely general surgeons number more than breast surgeons. How you get to be a breast surgeon is you have to do general surgery qualifications first, either master's or fellowship, and then you have to do subspecialty training in breast and endocrine surgery in Malaysia, or breast surgery, which takes anything from 3 to 5 years. So, if you are a general surgeon and you do have special interest in breast surgery, there are some in the country who might be able to sort out your problem. But if you can't, you can always seek a national specialist register to find out whether there are breast surgeons in your state or near your next door to your state to get an
Obviously,
opinion.
like any cancer. I'm sorry, I always interrupt because the question comes to mind and I'm too scared that
No
I
problem.
forget. Yeah, you know, aging. Okay, so you see now I've forgotten. Okay, like any cancer, like any cancer, like any cancer, of course, the ultimate aim is early diagnosis. Okay,
Yes,
and
yes,
we know that there's um, predisposing factors that can actually increase the risk of cancer in certain women. Okay, how strong is this family or family history of breast cancer? What is the risk like?
Mm. Okay, the risk factors for breast cancer would be um, the family history, which is about, depending on the population that you look at, between 20 to 30% have family history. Okay, uh, and then of course the risk is higher if you have first degree relative, which means your parents or your siblings. Why I say parents is because men also get breast cancer. I mean, people always forget that men also get breast cancer. I've got two patients whose fathers had breast cancer and
I
they had
see.
cancer. Yes. Okay. And then siblings, of course. And having a sibling, a sister with breast cancer or a brother with breast cancer, is gives you a higher risk compared to having your mother with breast cancer. Okay. And
Okay.
then, yeah. And what are the other risks? Alcohol intake, and that was a study in UK where even one glass of wine per day is risky.
I see.
Yeah. And then
Okay.
prolonged the other risk factors are if you get your menses at an early age below 10, or uh, late menopause, or prolonged hormonal use, especially in HRT, that increases risk for breast cancer. And then obesity is another recognized factor for breast cancer. And late first pregnancy, or not having children, or not breastfeeding your children. So these are the risk factors. But many, many times I've had patients who don't have any risk factor at all, and yet they have breast cancer. So which means they are the first,
Yes.
person in their family to
Mutation,
have.
maybe the first mutation, maybe. Can I ask you again? How about HRT? Does HRT increase the risk of cancer?
Yes, it does, but there are many women out there who actually need HRT to control their menopausal symptoms. For example, their mood swings, the hot flushes, having dryness, and so sometimes it's a bit difficult to cope. So they can be put on HRT, but all ladies on HRT need to have their mammogram annually to look
Okay.
for abnormalities in the breast.
I will ask. I will answer. Read out the questions later because I need to ask Aslina a few more questions. So, patients on HRT would you would ask them to do mammogram early? Would you say that? Of course, early detection. One of the best way is mammogram, uh, and you would advise patients with family history. How old would they start to do mammogram, and how often?
Okay, so it depends. Now, if the family member that had breast cancer, either the first or second degree, a relative who had breast cancer, uh, for example, if the relative had breast cancer at age 50, then you can start screening at the recommended age in Malaysia, which is around 40. Okay, but if the family member had breast cancer pre-menopausal, maybe at about 30 or 40s or even in the 20s, you would actually start screening earlier. I would start with ultrasound, and as it gets closer to the age of the relative with breast cancer, maybe we need to do a mammogram. However, you can have a choice for those patients who've had relatives with breast cancer in their 30s or early 40s. You could give them the option of doing MRI breast as
Oh,
a
I see.
baseline. Yeah, as a baseline, because when you do your mammogram at a very young age, it is a bit difficult to detect certain abnormalities because our breast tissues are dense, padat. So it appears fairly whitish on mammogram and you can't pick up much. That's why we tend to do mammogram with ultrasound. So because mammogram is low dose X-ray, ultrasound is high frequency sound waves. With both these modalities, you can pick up more than 80+% of whatever that ails the breast. You see, so and regular follow up. For example, just about 2 or 3 months ago, I had a
Mhm.
26-year-old who came in who felt a small lump. I could barely feel it. So I was very surprised. You know, usually a 26-year-old in Malaysia, they would wait. They wouldn't come one day after detecting a lump. But then when I asked her, she had an aunt who had breast cancer at 29. So she was very well aware. I presume that the aunt told the rest of the relatives, everyone, you feel anything, just go and check. So after that, I sent her for an ultrasound. The ultrasound showed the lump to be not so suspicious, but just at the back of my mind, having an aunt at 29 with breast cancer, I sent her for a biopsy. It had to be ultrasound guided because it was so small, can hardly feel it. So image guided biopsy, and it turned out to be cancer. 26
Wow.
years old. So, and the tumor was very, very small. It was only about 1 centimeter, and I was surprised. She felt it. So, it's good prognosis for her because she felt it very, very early.
So, can you just tell the rest of the women out there how important it is for breast examination?
I would actually advise once you are in your 20s, learn how to do a proper self examination. Yes, there are some studies that say it doesn't affect survival. But what else can you do to improve awareness? You must learn to examine yourself, and if there are abnormalities, for example, these are the common that patients always come to. They feel a lump, they feel uncomfortable or pain, though pain is not a common symptom of breast cancer. It's usually a symptom of just premenstrual pain or cysts, which are cavities containing fluid. So, learn how to feel your breast. Learn what is the usual, texture of your breast. If you feel a lump or if there is any discharge coming out of the nipple, you should get it checked even if the discharge is colorless, because it could be a tumor within the milk ducts called intraductal papilloma. Of course, when you get bloody discharge, everybody runs to the doctor, but there are many who have colorless discharge and do not get any medical attention until the thing becomes bigger and gets bloody.
I
So,
don't know why you are quite blur, but let's take some questions. So,
okay.
sorry, huh? Ash said she just had a mastectomy and axillary removal early last month. Oh, I'm sorry to hear that. Will the numbness under the armpit disappear over time? Uh, the feeling is like a mengepit, a purse under my armpit all the time. Well, okay.
Okay. Now, when somebody has, sorry to hear about your
Yeah,
diagnosis,
sorry
Al,
about that.
that you have set the wheel in motion, you've gone for treatment. So when somebody has mastectomy, axillary lymph nodes removal, it is actually in the axilla or your armpit, there are lots of nerves that actually uh, supply the sensation to your upper arm at the inner side. So these nerves are very, very small and they are inadvertently need to be cut so that we can access the lymph nodes. Now, lymph nodes are removed to look for whether there's any spread to the lymph nodes from the breast cancer. Now, with what would help you is to make sure you are taught the exercises that improve on the circulation to your shoulder joint, and also having some supplements like neurobiome, which is actually vitamin B1, B6, and B12. These may help in the long run to improve on the nerve growth, the nerve endings that will grow slowly over time. But they may not become 100% like before. But the exercises that you do will improve on the blood supply to the area and will help your nerves become better with time. Please don't expect that it will go back to 100%, but most of it can. You can try and ask about having some neurobiome. Okay, now neurobiome is also used in diabetics to improve on nerve issues.
Okay, I want to
Yes.
ask you, because when you take out the lymph nodes in the axillary area,
Mm-hmm.
sometimes we see women with swelling over the hand. Can you
Yes.
explain the process behind
Yes.
that?
Okay. So what happened is, okay. Now this is a picture of the breast with the green things are actually the lymphatic system. Now we have lymphatic, the superficial and the deep lymphatic system over the breast. Now the lymphatics are seen everywhere in the whole body. This just shows where the relevant
Yeah.
part at the breast. Okay, so when we remove the lymph nodes, we cut out the circulation, the original circulation, but the lymphatics will find its own way back into the body. Now, what happens during axillary operations is that some of the lymphatic channels might be disturbed, and if the patient is not taught exercises and also not told to avoid wearing tight things on that particular arm, like rings or bangles or watches, that might be increasing the risk of what we call lymphedema. Okay,
Yes.
the other thing that I always tell my patients, okay, um, the side where you have the cancer, treat it very, very carefully. Don't carry heavy handbags, carry it on the other side. You see, women, once you have your favorite side to carry the handbag.
Yeah,
So
yeah, yeah.
once I tell them, okay,
Ingrained
now
in you.
you need to learn to carry on the other side. And I usually tell my patients, don't carry more than 2 kgs on that particular side after you've healed, and then keep on doing all that stretching exercises that are recommended after having breast cancer surgery, and stop wearing rings on that side because that might cause increased risk of lymphedema. Another thing that I always advise patients is, remember, do not allow anybody to take blood samples or check their blood pressure with the blood pressure cuff
I see.
machine on that side, so you reduce risk of lymphedema in the long run. So
Oh,
mm,
I didn't know that. But I mean, when I was, of course, a houseman and a medical officer, and it's something that's quite difficult to treat once it comes, right? Because
yes, definitely, yeah. You would have to have regular physiotherapy. There are some very few clinics that do physiotherapy centers that you do lymphatic massage. You have to look for them, and also it's prevention rather than, because it's very, very difficult to cure. There are also compression garments that are available
Mhm.
in the hospitals, and there are some expensive ones where you can get it personally made, but usually we can also use the lymphatic pump for lymphedema, which is available where I work.
Oh, okay. No,
Okay.
Barney said, is
Okay.
male breast cancer due to genetic because her husband is one of them? Oh, I'm so sorry to hear that. Yeah, maybe you mentioned just now briefly about male
Yeah,
breast cancer.
it's possible, but only a genetic test can confirm it.
Yeah,
So I
so
would
it is
rather
genetic.
not. Yeah, And genetic tests are now quite easily available, and in certain centers. But when somebody goes for genetic testing to look for the genetic risk for breast cancer, I usually tell my patients, go to a center where they have genetic counselors, because you need to discuss first what you're getting yourself into. Because if you do any genetic test, um, your possibility for insurance coverage might be out of the window. So
And
you need to
there is
discuss.
also the difficult decision on whether you want to get both breasts out if you test
Ex-
genetically. Yeah,
exactly. So
quite
yeah.
it's
Hmm.
quite like pressure upon you. It is not that
Mm-hmm.
it's bad not to know, but
Mm-hmm.
sometimes it is a difficult choice when you know. Okay,
Exactly.
we
So
do
that's why, yeah, the okay. Some
my girl
okay.
said she can see me smiling when it comes to alcohol. Cause okay, yes.
Quite open.
Okay.
Okay.
Ashling said, will okay.
Yeah.
Ashling said, will a person who has chronic granulomatosis
Granulomatous granulomatous mastitis have
I don't know
higher
what.
risk. Okay. I wrote a paper on this when I was in the masters. So chronic granulomatous mastitis is actually thought to be an autoimmune problem where the person presents with inflammatory symptoms like redness and pain, but they don't get so much of abscess. And how we diagnose it is with a biopsy. We do the usual mammogram, ultrasound, and a biopsy. Now, it can be mistaken as cancer because on ultrasound it can look quite suspicious. We do not know of any increased risk of breast
Okay.
cancer. So,
So Michael
right.
said, can axillary abscess be an early sign of cancer?
Yes, it can. It can. So we do need to look at the breast itself, do the ultrasounds, and sometimes we need to do a biopsy. So if the abscess is obviously through, for example, infection, inflamed area, redness, fever, etc., most likely it's just the usual abscess. But a lot of times we send tissue biopsy to rule out cancer.
Okay, Nobani said she's just met a breast cancer survivor. She claimed that she had it at a very young age. Later, she got married and a few kids. I just wondered that hormone will increase during pregnancy. Oh, okay, so what she's trying to ask is the hormonal changes during pregnancy for a breast cancer patient, does it put the patient more at risk eventually for a flare up maybe?
Well, it depends on the subtype of the breast cancer. You see, breast cancer, there are many subtypes. There are hormonal positive types, there are hormonal negative types. Uh, so there are hormone changes in pregnancy that we know. Usually the breast cancer survivors are monitored very closely. They are allowed to have children, but they have very closely monitored pregnancies.
So there, yeah, I think it is very difficult to stop a woman from wanting kids. So
Of course,
yes,
yes.
yes.
As long as
Um,
they, yeah,
and she wants to share this video. Please share. Sharing is caring. Can a
sharing is
doctor?
caring. Yeah.
Okay. Annabelle Tan asks, can a doctor confirm a patient has breast cancer based on mammogram and ultrasound? I think we have answered that. We can confirm by
Yeah,
about
we
80.
need tissue.
Yeah.
Yeah, we must confirm it with a tissue biopsy. Okay,
Yes.
because we need proof to know what we're dealing with. A mammogram and an ultrasound are just supportive evidence. It does not tell us the patient has breast cancer. It's just highly suspicious. Once we have tissue diagnosis, that means we take some sample from the area of concern, send it to the lab, and the pathologist will confirm if they see cancer cells. They must have a biopsy. This is a good question, Betty, because sad to say there are still women out there having breast cancer surgery with no done.
Biopsy? Is that even
Nice.
possible?
Well, it's
Oh,
possible I get second opinions all the
I
time.
don't want to know. I don't want to know. But can you just tell us what kind of biopsies are there? What is the difference between cytology and a biopsy?
Okay, cytology. For cytology means cyto means cells. Okay, so what the doctor is doing when they do fine needle aspiration cytology (FNEC) is they take a syringe and they try and syringe out some cells. Okay,
Okay, she's a bit
this
laggy.
true cut or core needle where we take a larger tissue sample, but we give have pain while we are doing the biopsy. The pain is only when the injection is being given. With
Okay.
cytology, you can't give local,
Oh, you can't give
very
local.
small,
Oh,
and
sorry.
no, then you'll be
You're a
sucking
bit
out the
laggy.
local.
Oh, yeah. You'll be okay.
Yeah.
Okay,
The thing,
that's true. That's true.
yeah.
That must
So,
be my
so
mind.
when we do psychology, you see, it depends on where you work. I always tell my colleagues, I'm not saying doing cytology is wrong. It's not wrong. It is also correct, provided that your center where you send the samples to has pathologists well trained in cytology. And there are not many cytopathologists. The majority in Malaysia are general pathologists. So to me, it is better to take a larger sample, give the patient local anesthetic, and after biopsy, they are given uh, Panadol or some anti-inflammatory to reduce the pain for a couple of days. Most of them don't take it anyhow, but I do give them some pain relief. So doing a true cut or core biopsy gives the pathologist more cells to look at and to come to a diagnosis of breast cancer before we plan
More
for
accurately.
surgery or plan on chemotherapy for the patients at whichever
So it is
stage of the
very
cancer.
important to, at this point of time, stress that yes, mammogram and ultrasound are very helpful investigations in the diagnosis
Yes,
of breast cancer, but
yes.
do not do anything just based on that. You really need a tissue biopsy.
Yes, remember I said about the chronic granulomatous mastitis.
That's
Now,
right.
it
It can be
can
very
look like breast cancer, and if you just proceed doing a mastectomy based on the mammogram and ultrasound, later you might find out it's not cancer, and
yes. You can't
you know
get back your breast. A friend of my
exactly.
mine
Yes,
said, a friend of mine in the late 20s, she used to go for minor surgery on removing abscess on the left armpit. But not more than a year later, she was diagnosed. She developed another abscess, but this time over the right armpit. She never went for further investigation. She only went to, okay, some people are more prone than abscess, more prone to abscess. So, yes.
yes, but
Uh,
there is a condition there where you can get frequent abscess, and it's called hydradenitis suppurativa. Okay,
oh
it's
my
where
God.
you where you
Okay. Yes.
it's actually abscesses of the sweat glands, and there are some women who have very frequent infection there, and sometimes if it's so bad, they need a big surgery and some tissue
Yeah.
transfer. So it might be this condition, hydradenitis suppurativa.
Okay, so it is not everything is breast cancer because we are not Dr. Google.
No,
Yes.
no,
So,
no.
yes. Ashling said, I used to do a lot of weight workout. How soon can I resume my workout after surgery? After 6 months? And she apologized for too many questions. Oh, no need apology at all.
No, no, don't apologize. You'll
We're
be
just having a chat.
more aware of things. Okay, so you've had mastectomy and axillary clearance. Start your gentle exercises on day 2 after surgery, and then when you are comfortable, you can start doing weight. Now, workout, I wouldn't advise you to do heavy weights until about a month or so. let it recover nicely. But you can do gentle weights like 1 kg or 2 kg, and depend more on repetitive movements rather than the weight itself. You see, weight workout, you can do repetitive movements rather than, 5 kg or 10 kg. Because if you start to carry too heavy things in the beginning, you might get the higher risk of having lymphedema. So that's bad. So be gentle on yourself.
Okay. Annabelle Tan
Okay.
said, with CT scan, biopsy, and blood test report, can the patient be able to confirm that the patient has breast cancer? Again, we have answered that. CT
I
scan.
think uh, I think what happened is they're asking just CT scan, biopsy, and blood test. No, you need to have a mammogram and ultrasound and a biopsy. The CT scan is for staging of breast cancer because breast cancer to the uh, lung, liver, bones, and can spread to the brain. So, blood test is not confirmatory of breast cancer. So you don't need to do a blood test to confirm breast cancer. The blood test is a baseline so that we can look out for some tumor markers in the following years in case tumor markers raised that could highlight the fact that the person has a recurrence. So you still need mammogram, ultrasound, biopsy. The CT scan is for staging,
Oh, okay. Can I
baseline
ask you
for future use. And fitness for further. Yeah.
about this tumor marker? What tumor marker is it related to breast cancer?
Ah.
Is
Uh-huh.
it say what you very like? What tumor marker is related to breast cancer and how accurate is it? I think we lost Aslina there for a while. She's frozen, like in a movie.
It's
Okay.
non-specific, and that's why I don't even do. Uh,
Oh, you don't? Yeah.
ah.
Sorry, Aslina, you're really,
So,
really laggy. Are you
okay,
okay?
hang on.
Yes. Are you okay?
Okay.
Okay. So,
Okay, the tumor markers.
yes, yes. You are at
Okay,
the
the
tumor
tumor.
marker.
Yeah, the tumor markers that people frequently use when
Doing
the patient
screening.
is diagnosed with breast cancer is CEA, CA125, and CA153, but they're very non-specific. We do them at the point of diagnosis as a baseline, but almost all the time it's not. Okay, and we use it as a reference point for later use because sometimes these tumor markers are elevated, and that may be the suspicion of recurrence, the point of diagnosis in the future years. So we don't actually depend on the blood test, on the tumor markers.
Because I'm asking you this because a lot of time, these tumor markers are added in the screening program. So sometimes it is
Mm-hmm.
very difficult to interpret, just because they are all healthy
Mm-hmm.
patients, but then suddenly um, they may have breast cancer, but again, it is normal. So it is very difficult to explain to patient why sometimes tumor markers are not accurate, especially for breast cancer.
Yeah,
Um,
they're not CA125 and CA153 can also be elevated problems.
oh, you're so laggy. I'm so sorry. But Nobani asked, do you have any you? She doesn't want to know about me. But she wants to know, do you have any Facebook or website blog? Excuse me, this is my show, okay? She doesn't
Oh
want to know
no!
about me.
I know it's Betty show. It's Betty show.
So she asked me whether you have any website or blog that she can read up and refer to. Well, she's going to.
No,
She has. She
uh,
doesn't have it yet. She doesn't have it yet.
I am.
But tomorrow she's going to
Yeah.
start.
No, no, no.
Tomorrow she's going to start. It's so funny. Today, just 3 minutes before this live chat, I was asking Azlina whether we wanted to do the interview in Malay. And the reason is tomorrow is Merdeka Day. So I thought, okay, let's show everybody we are Malaysian. Why don't we do this interview in Malay? And Azlina said,
Uh-huh.
okay, we can mix. Then I'm thinking, okay, never mind. Too scared. And then and then yeah, it's a bit difficult to just switch off your mind from asking questions in English and then asking questions in Malay. But I'm going to try. I'm going to try because I met a guy on a few days ago, and he said, if you want to penetrate into politics, start talking in Malay. So I'm going to practice. You never know.
You want to get to politics? You want to get to politics?
I don't know yet. When I grow up, maybe when I grow up. It's just a thought. Yeah. Anyway, we have spoken for we're almost an hour now.
Yes.
If there are no more questions, I think we have covered quite a few things. Yeah, and then we have covered things that we didn't cover last time. But
Yeah.
last question from me is, okay, since we are all both wearing pink, can you just tell us about this pink movement? Yeah.
Okay. Well, October is International Breast Cancer Awareness Month. So usually there'll be a lot of organizations and NGOs that want to improve on awareness of breast cancer. And in fact, a lot of hospitals in Malaysia will have special packages for mammogram and ultrasound at a discounted rate. Please avail yourself for all those investigations so that we can detect breast cancer much earlier than what we have seen so far. Also, there will be talks, and I guess being with COVID and all that, we'll have more on social media to
That's right.
improve awareness. Yeah, and why they chose pink? Actually, I don't know why it's pink,
All women
but
are associated with pink. When you have a
yeah, but I
baby
know
who's a girl.
yeah, but I know some women who hate pink. They would rather
Yes.
be, they wouldn't be seen in it. But well, so that is the thing. It's International Breast Awareness Month for October. In the past, we've seen many iconic buildings being lighted up,
Yes, very beautiful.
including
Yeah.
our Twin Towers, our Menara KL, over the years. And we've had the Sydney Opera House, we've had Eiffel Tower, all bathed in pink. But you can get carried away with this pink notion, but I feel that as long as our awareness doesn't improve. I mean, I still see patients coming with stage 4 breast cancer in this day and age. When they actually have insurance, they've gone for alternative therapies, supplements, etc. It doesn't work. It really doesn't work. Don't waste your time and money.
Okay,
So
I want to tell the public why we don't believe in alternative medicine. Now, I want to say that there is a lot of money to be made from medication, from chemotherapy, from treatment of cancer. Okay, a lot of money to be made by pharmaceutical company. And if there is a drug or any therapy that is alternative that can really work, believe me, this pharma company would have hunted it down. Okay, because if they research on the drug or alternative medicine, okay, that work, they would have this patency for 10 to 15 years and nobody can sell it. Okay, and they can actually sell it at whatever price they want. So there is always a reason why um, we know, not that we think, that alternative medicine doesn't work. Everything we practice is basically based on evidence.
Exactly.
Okay, it's very important. Means that we don't just pick and choose what regime we want, whether we should just chop off your breast doing mastectomy or lumpectomy. We can tell you, okay, the differences, whether there's any differences, and we're talking about survival. Okay, that is very important. Means that it is very important to know that all, okay, almost all doctors practice evidence-based medicine. Our practice is based on some research that has been done, and then we translate this research to what we tell you. Okay, I would like to say that the breast cancer, the Society for Breast Cancer Survival is very, very supportive. I'm sorry to hear that some of you have had breast cancer, but please seek out support if you need. Okay, uh, the support for breast cancer is huge, and they have a lot of NGOs associated with it. So there's a lot of things that you can actually, a lot of people you can meet and share. So it's very important for that. So for all those who has been recently diagnosed or who has been diagnosed, hang in there. Yes, there's we are very hopeful that treat it like what you say, a chronic disease.
Yes, yes, yes.
Is it
That
chronic?
many things we can do for breast cancer patients. You just need to get to the right place, get the right advice. Okay.
Yes.
Yeah.
And alternative medicine, please, if you need alternative medicine, always do it with what the doctor has advised.
Yeah.
Yes, you can
That will
try.
be complete.
Don't dismiss
Yeah.
the true therapy. Okay, don't dismiss
Yeah.
it. Okay,
Yeah.
thank you
We
very much,
discuss.
Ashley.
Always
Yes,
discuss. Yeah.
I'm glad to have you back, and I'm so
Yep.
sorry I would not touch anything tonight, and I will definitely will not. I have already upgraded my StreamYard, so I can record it now, so there's no worry about
Oh,
it. And maybe
wonderful.
yes, yes. So I will make sure I'll share it in YouTube too. And thank you very very much. I see
Thank
you
you.
then.
See you. Thank you. Bye.
Okay, guys, thank you for tuning in. Next Wednesday, we have another live chat. This time, we're going to speak to a cardiothoracic surgeon on all the surgeries that we do for the heart. I'll tell you more as we are nearer to the date. I see you guys. Bye.